The HSE has responded to reports of complaints and upset among some of its COVID-19 contact tracing staff. The problem stems from a decision to defer plans for 100 promotional posts and also a change to working hours. Our health correspondent Fergal Bowers has a story and joins us now. First of all, Fergal, starting at the very beginning, how does the contact tracing staff operate and where are they based?
Well, the HSE contact tracing centres are located in Dublin, Limerick, Cork and Galway, and around 1,000 staff work in the contact tracing system. And there's three types of contact tracers. Call 1 tracers, probably the most crucial role. They inform people that they've tested positive for COVID-19 and they give information on how they can protect themselves and others. And Call 1 roles are for clinical staff, and they're more complex, they take longer. They attract a higher pay of up to over €47,000 a year. There's Call 2 roles, which is collecting information about close contacts, and then there's also Call 3 roles, which involve contacting close contacts.
And so what was behind the reports of the discontent?
Well, in correspondence seen by RTE News, the Contact Management Programme told staff on the 13th of July that due to the rapid rise in COVID-19 cases and future modelling for cases, it wanted to upgrade contact tracers on a temporary basis from Call 2 roles to Call 1 roles, the more important ones. It said, quote, "At this juncture, where we are faced with the threat of a substantial increase in demand, it's important that we draw on our valuable existing resources to ensure capacity and a safe and robust service." At that point, it said it was dealing with about 600 cases a day. And also, I think the contact tracing programme, it was losing some Call 1 staff, many of them nurses, as you know, some of them opted to go back to the wider health service to work. So in mid-July, the contact tracing programme sought expressions of interest for the upgrade posts. However, on the 12th of August, by email, the programme told staff it had been decided not to proceed with the upgrade posts at the present time, and it thanked staff for their expressions of interest for the roles. Now, you know, I've spoken to a number of staff and they're deeply upset.
And so they're upset with the way things have been developing. What has the HSE been saying in response?
Well, the HSE has responded to the reports of complaints and upset. Among the staff I spoke to, they said a lot of staff had put in extra work efforts to get the posts, and they were going now. They also claimed there were moves by the contact tracing programme to merge Call 1 and Call 2 roles into a Call 2A role, with staff required to fulfil these tasks. And the contact tracing programme also decided to change working hours from August the 9th from 8 a.m. to 8 p.m. to 9 a.m. to 7:15 p.m. It's claimed without consultation, so that's caused upset. Now, the employment contracts for contact tracers are outsourced by the HSE to a private firm, CPL Healthcare. The HSE statement answered some of my queries, but not all of them. In the statement, the HSE said that following an increase in COVID-19 case numbers, it had moved to implement surge measures within its contact tracing system. Quote, "Although we regret that this has meant we are unable to proceed with the expression of interest process at this time for the upgraded posts, the decision was made in the public interest." And you'll recall that yesterday almost 1,500 new confirmed cases of COVID-19 were reported by NPHET, and last Saturday NPHET reported over 2,000 new cases, the first time it had over 2,000 cases since the 21st of January.
Fergal, just broadening things out now to the wider vaccine rollout programme, we were hearing from Professor Paul Moyna earlier on just about this new initiative of mixing vaccines, but he felt it was going to have a limited effect because it was only going to apply to a small number of people. Where do things currently stand?
Yes, it will have a limited effect because it really relates to people who got first dose AstraZeneca and may have wanted to wait for the possibility of a second dose mRNA vaccine. Now, no decision has been made in relation to mixing vaccines for the planned booster programme, although we may hear news on that next week. Now, yesterday NPHET reported, just under 1,500 cases, 248 patients in hospital, of whom 54 in ICU. NPHET says the current 14-day incidence is 493 cases for every 100,000 people, the highest it's been since January 31st. And the incidence of the disease, it says, is continuing to rise steadily in nearly all age groups and in 21 of 26 counties. Now, early last week, we were seeing on average of 3 people with COVID-19 being admitted to ICU each day. That's doubled now to 6 a day.
Sorry, go on.
Obviously, the vaccination programme has had a hugely positive impact. If we didn't have the vaccination programme, the estimates is that the current 14-day incidence would be around 1,000 cases for every 100,000 people, and we'd be seeing 50 people admitted to hospital for every 1,000 cases reported. Instead, at the moment, we're seeing around 20 people admitted to hospital for every 1,000 cases. This can all get back on track over the next coming weeks, depending on people's approach and people being careful. So, it's getting more worrying, I think, in NPHET's feeling, but it can be managed and got back on track.
RT News health correspondent Fergal Barras, thank you very much for joining us.